I take care of a lot of different areas around the face. My primary focus is around the eyes, upper and lower eyelids, and brows, but I do some work in the lower face as well and in the cheeks. It depends on really what my comfort zone is and where the patients are interested in. I like to really try to do the things that I'm an expert in. So I try to be a specialist. I'm not a jack of all trades, but I think that's one of the things that sets me apart. I'm really specialized in this area, so we know we can do a great job.
For the most part, most of these things are absolutely comfortable. Depending on what people are having done, the injectables, a little bit of numbing, topical numbing, and then they tolerate it really well. Our different lasers are also very tolerable, but each are a little individual, and so we would discuss exactly what to expect. The nice thing about most of our lasers, people are kind of back to their normal very quickly, most things next day. There's absolutely nothing wrong with wanting to feel your best and age as gracefully as possible.
Casey is indispensable really to the practice. She's really one of a kind, actually. In North Carolina, there's only one other PA that we know of, and there's no one else that does oculoplastics as a specialty. So we're really lucky to have her. She does a lot of preoperative care, postoperative care. She does procedures in the office, and she really is kind of a second arm of my care. So we really work together. The patients are all really ours as a team. And without her, I probably couldn't pay as much specialized attention to the patients, because Casey's really there getting all the details and helping me really manage them from a day-to-day basis. Casey's been with me for 9 years now, I think.
Yep.
And she started with me right out of school. So I got the benefit of actually training her from the beginning just to do this specialty. I really do feel like she's an extension of me. I think it's a pretty special experience to be treated by our team, actually, and particularly because Casey's here. But also the technicians that work in my staff, we're all part of a team that never changes, really. And so we've had a lot of stability over this time, and everybody is really working on the same page to provide care. So instead of just getting care from one person, really you're getting care from 4 or 5 different people that are specialized in this practice. I think we're the most experienced team really in town. I've been in practice for almost 20 years. I only specialized in this area. So over the years, I've done thousands of surgeries, both cosmetic and medical or reconstructive. The addition of Casey to my practice, as I mentioned before, is indispensable, really. I couldn't do it without her, because it allows me to really focus in and provide personalized care and individualized care. In this practice, I actually do all of the injectables personally, which is kind of unique in the community. You don't really see that as much as you used to anymore. I prefer that. Casey is certainly capable of doing it, but I prefer it because I still like to have that one-on-one individualized treatment with patients, and I think that does set this practice apart, actually. So Botox or fillers or anything like that is something that I would do personally. Casey does do some of our cosmetic treatments with lasers, actually, and she's quite skilled in that. She's been doing that for a long time, as well as our dry eye treatments with laser, and she's been doing that since we started, really. We've got probably the most experience in the community in doing dry eye treatments with laser. Dry eye is, for a lot of patients, a chronic condition, and it can have ups and downs to it, actually, and lots of different reasons behind why somebody might have dry eye. But the most common reason that we see in our offices is inflammatory causes of dry eye. And the reason why the laser works so well for that is because it treats the root of the inflammation. Patients have to be evaluated to see if they're a good candidate for it. Not everybody is, but when we are able to determine that somebody can do well with dry eye treatment, it's often a last resort for patients who have tried everything. They've tried every drop, every prescription, everything over the counter, and they're doing everything they can. And this is an added treatment for them to help really get to the root of the problem. It's an easy office procedure for patients, really. It usually takes 15 or 20 minutes to do the procedure. And most patients we can get onto just a maintenance treatment once a year, and it can really help supplement what they've been doing for their dry eye.
Our lasers work to help people reduce inflammation and to make the eyes feel better in general. We have lots of different options as far as the dry eye treatments.
I would consider us to be one of the advanced dry eye care centers in Charlotte. That's different from really just the routine care that you might get at a general ophthalmology practice. And because we're so specialized and experienced with the lasers, and because our equipment is more advanced than most practices have, we can do a little bit better job for patients who are really struggling at the end of their path with the dry eye.